My philosophy about providing great patient care and the doctor-patient relationship really comes down to what's the best for the patient. Trying to always put the patient first and having the staff that can be understanding, the staff that can have the same attention to detail as I would want. And one of the things in our practice, we talk to our employees about treat this like it was your family. What I would hope that patients know about me when they come and they meet me for the first time is that I really care about the problem they're coming to see me for. Sometimes it's simple, fairly easy to take care of, but they're anxious about it and it has a big impact on their life. Robotic surgery is really an exciting part of my practice. It has taken me from laparoscopic, which is minimally invasive surgery, to a level where I feel like I can do so much more in a minimally invasive manner. So with traditional laparoscopic surgery, sometimes there's limitations because of articulation, or I can't make the straight instruments do what I would like my hands to do. But the robot is like having your hands inside, but they're little teeny tiny. So I sit on a console and make the instruments do whatever my hands do. Part of my philosophy about robotics is I took it on, I really felt like it was better. In order to be good at it, I tend to do everything I can robotically so that I have those skills. But I still do things laparoscopically. And my robotic experience has actually enhanced my experience as a laparoscopic surgeon. For the patient, some procedures done robotically, I think, allow them to go home sooner. We have less blood loss, we have smaller incisions, the bowel function will return to normal sooner, which gives them the advantage to go home. The doctor-patient relationship is probably the most important part of it. I mean, I have to be able to understand my patients, I have to understand what's important to them. So you have to know those patients. They have to have confidence in you and know they can trust you to do what they would want. Scripps really expects us to have a high level of expertise, and the processes that have been put into place really insist that every surgeon have a certain level of training. One of the things that I've been privileged to be a part of as a robotic surgeon with probably one of the busiest robotic practices in general surgery is to participate with the minimally invasive fellowship. Because of my experience with robotics, I am able to teach the fellows. The idea is to make sure that they possess the skills and the experience before they go out and are in practice on their own to be safe robotic surgeons. I think the most satisfying part of my job is really that relationship with the patient. And I get to help them get through a difficult time with caring and kindness, and I get to see the great result at the end.